Hi, my name is Manoj Krishna. I'm a spine surgeon. I've been a surgeon for 16 years. Today I'm going to talk to you about pain that recurs after doing a lumbar discectomy. Now, the lumbar discectomy is the commonest spinal operation done worldwide. It's done for a prolapsed intervertebral disc which causes severe leg pain and sciatica, and removing a small fragment of disc which is pressing on the nerve provides instant relief, and patients are delighted. Now, most patients do really well initially, but about 20% go on to develop recurring back pain and leg pain. In some patients, this can be severe and not respond to conservative measures, including physiotherapy, painkillers, pain management, injections, etc. And they need more treatment. Now, why does this occur? Well, you know, the disc that prolapses is already degenerate and torn inside. So this process continues over a period of time. In addition, we know that discs in the lower lumbar spine carry much more load in the sitting position, for example, than in lying position. In the sitting position, the pressure through the L4-5 disc is 1200 kilopascals, but in the lying position, it's only 90 kilopascals. So these discs are load-bearing structures. We've also found through research that these discs have high concentrations of inflammatory chemicals, which is what causes the pain. So it's logical that if one is going to treat these patients, one has to take out the pain source, which is the disc, and put something in the disc space to restore the load bearing across the disc space. So the surgery that is quite successful is called a less invasive posterior lumbar interbody fusion. We've published a paper on the subject, and there's a link to that from the website. Now, our patients are caught usually in a vice between their fear of treatment on the one hand and their pain and disability on the other. Here's a case study which illustrates the problem.
Hi, my name's Wendy. I'm 49 years old, and I had back surgery 6 weeks ago.
Okay. Tell us a story, Wendy, about how the problem started.
The problem started with disc problems through a misspent youth, motorbikes, horses, and all those kind of things, skiing, and a lot of accidents. Okay. And then one day I just had I bent down, stood up, and that was it. So then the pain got worse and worse and worse for many years. For about then I had a disc surgery about 10 years ago, where they and I don't know what. Can't
they did a discectomy.
Discectomy. That's
where they took the disc out.
Yeah.
Yes.
And it was only good for about a year, and then it got worse and worse. It got more and more painful. I could do less and less and less, and being a very active person, I found it very frustrating. I took a lot of painkillers. I drank a lot of wine to go with the painkillers, because
it's a pretty standard cocktail.
Yeah. And I just really didn't have a life. Now, I have my life back. I have no pain. I sleep for the first time in about 10 years, which is great. My children say I'm nicer because I'm not all crabby. And I'm really looking forward to being able to do all the active things that I used to do. Ride horses, ski, but I'll stay off the motorbikes.
Okay. So what happened in the 9 years? Why did it take you so long to seek help?
Because I was scared of more surgery.
Right.
The first round of surgery, it went well surgery-wise, but I got an internal infection afterwards. It was very, very, very painful, and I had less than a year of good out of it, and then it started deteriorating, and it just kept getting worse, and I just got to do less and less in my life and live with a lot of pain.
Right. And describe your experience of surgery. How long were you in hospital for, and so on?
Oh, the PLIF.
Yeah?
Oh, right. No.
6 weeks ago.
Yeah, 6 weeks ago. I think I was only in hospital for about 3 or 4 days. I don't even know how long the surgery took. I was in there early in the morning, woke up, had a good kip. Nursing staff were great. They have a great sense of humour there, I have to say. And I was home and walking around and thoroughly enjoying myself.
And you're saying your
within-
memory has
within
improved as well.
my memory has improved hugely because I'm not taking a lot of painkillers with a lot of wine.
Okay.
I'm a nicer person because I'm sleeping.
Yes.
Huge difference.
Sleep is so vital, isn't it, for
Lack
health?
of sleep is a form of torture.
Oh
You know,
my
it makes
God.
life very difficult
Very
to cope with when you can't sleep.
Thank you very much.